Hi, my name is Dan Frith. I'm a lawyer here in Roanoke, Virginia with the Frith and Elman Law Firm. We spend most of our time representing patients in claims of medical negligence, medical malpractice against their healthcare providers. And as a result of that, we like to share from time to time with our clients and potential clients some of the work that we're doing here. And I want to talk a little bit today, very briefly, about surgical malpractice and give you some examples of surgical malpractice that we see in our offices. It's been estimated by several sources that somewhere between 15 and 40 million surgeries are performed every year in the United States. The most common surgery performed in the United States is an appendectomy. That's when the appendix is removed from a patient because it has ruptured or is about to rupture. Now I want to talk next about risky surgeries. Obviously, all of the complex surgeries present grave risks to the patient. Heart surgery, brain surgery, organ transplant surgery, and cancel removal surgery. All of those are very complex surgeries which have high risks that attend to them. But absent the complex surgeries, you might be surprised about what we see commonly and what is documented in the literature as some of the more risky surgeries. The first I want to talk about briefly is colon resection or colon removal. That is done typically when there's a cancerous tumor or possibly a colon perforation that occurred as a result of progressive Crohn's disease or diverticulitis. So when the surgeon goes in and removes a section of your colon and then reattaches the two sections, the two ends, and you go on about your life. But there are great risks attendant with that surgery, risks that we can't go into detail in discussing now. The second is small bowel resection or removal. And again, small bowel like colon, you have a large colon and a small colon. This is a different part of the food tract, if you will, that often is operated upon for cancer and other issues that affect that. Surprisingly, everyone thinks gallbladder removal is pretty routine. It is fairly routine. However, it can have lots of very, very serious complications. The gallbladder is removed oftentimes because gallstones block the flow of bile, which is made in the liver and stored in the gallbladder. And that blockage causes the patient symptoms and problems, and the gallbladder has to be removed. That can be removed by a traditional open procedure or a laparoscopic procedure where there are multiple holes placed in the abdomen and the surgery is performed through those holes using a laparoscope. Another risky surgery deals with peptic ulcers. And in peptic ulcer surgery, what the surgeon does is he has to repair the ulcers that are in the stomach, on the stomach lining, or the first part of the small intestine. There are multiple things that can go wrong with this surgery, and it probably ranks within the top 5 to 10 surgery complications or potential complication surgeries known. And last is the appendectomy. We talked earlier that the appendectomy is pretty routine. It can happen and be required of a pediatric or adolescent child or a 50-year-old, 60-year-old, 70-year-old adult. It knows no age, it knows no sex. It is very common, but there are complications from that. If you have further questions about this topic, please do not hesitate to call us or email us. Thanks.